Welcome to a short session on the treatment of patients with pancreatic cancer. Today I thought I will discuss with you the way in which we treat our patients after a VIPUS operation. Now, just to touch on the basics, a VIPUS operation is done for patients with pancreatic head cancer, and it is considered to be one of the more complex operations in the world. Today, we have much more better technologies and we understand the problems in a much better way. So we are able to give better results for everyone who undergoes a VIPUS resection. So the timeline for VIPUS resection recovery is about 10 to 14 days. And on each day after the VIPUS operation, we have a specific strategy. On postoperative day 1, we look for bleeding from the surfaces we have cut and also from the connections we have made in the human body. So the bleeding can come either through the tube that is placed in your belly at the time of surgery, or through the tubes that are placed inside your intestinal tubes. So they can be either intraluminal or extraluminal bleeding. The treatment strategies will depend on the type of bleeding and the severity of bleeding. We have lots of non-surgical methods, but sometimes you may require surgery to control the bleeding. This usually happens on postoperative day 1 to day 3. I also must tell you that it has become very rare nowadays. The second step in your progress is on day 3, when we find out whether the pancreatic connection to the intestine has joined well. So that is tested by testing the fluid from your abdominal drain for amylase. It tells us whether the connection is secure. If the connection is secure, you will be started on tube feeds through the nasojejunal or the feeding jejunostomy tube, and that will be the first stage completed in your recovery. The next phase is to find out when the stomach starts working. Usually we give up to 10 days, but most of them do recover by 5th to the 7th day, but we can wait up to 10 days. The nasal tube that drains the stomach secretions will tell us and give us a clue about how the stomach has started functioning. So once the drainage decreases, we can start you on oral feeds. That is, you can take things with your mouth, and if your stomach is working well, it will properly take the food to the appropriate parts for digestion. Most of the time, delayed gastric function, that is, a slow functioning of your stomach, is an indicator of underlying problems. So this is the normal course. Sometimes we wait up to 14 days for them to recover. The wound sutures are usually removed on postoperative week 3, and sometimes if the muscles are very weak, the skin staples are removed on postoperative week 4. This will complete your recovery. We have made this standardized so that each one of them will can understand the process and can tick off the completed ones and ensure your complete recovery. Thank you.